The prostate gland, that's something I think has something to do with your metabolism or something. Has something to do with, it's got a bodily function. Let's put it that way. I don't know exactly what it does.
It has to do with the intestines and whatever. I don't know. I don't really know very much about the prostate.
I've heard a little bit about it on the news lately, but I don't really know.
In a man and a woman, I think that the prostate gland is relatively in the same area of the body, I would think.
The only thing I know about prostate, I believe it's in the urine. And
prostrate.
Please do not try to hit.
Lots of people have misconceptions about the prostate gland and its functions. In fact, many men don't find out anything about this gland until problems develop, usually after the age of 40. Prostate diseases are extremely common among older men. The most common single disease involving the prostate gland is BPH, or benign prostatic hyperplasia. Only men are affected because the prostate gland is only present in men.
What time is it?
Not bad for a bunch of old men.
Who's old? Oh, okay. Sorry.
The prostate gland is located at the base of the bladder where urine is stored. It surrounds a part of the urethra, the tube that carries urine from the bladder through the penis. The primary function of the gland is reproductive. It contributes to the fluid that transports sperm cells out of the body. A male infant's prostate is about the size of an almond. It remains that size throughout childhood. During puberty, the prostate approximately doubles in size, then growth slows. After age 40, the prostate often begins to grow again, influenced in part by hormonal factors. Sometimes this growth continues for the rest of a man's life. By itself, prostate enlargement isn't dangerous. But as the prostate continues to grow, it can squeeze the urethra, like pinching a straw, and interfere with the normal flow of urine. This can cause uncomfortable and embarrassing symptoms.
I was getting up once or twice a night, and that gradually increased over this 3 or 4 year period. My stream was a lot smaller, decreased in size. The stream really had no force to it. On occasions I had urgency. In other words, if I had to urinate, I'd have to go right now. Couldn't wait. Had to seek help then.
An enlarged prostate generally does not interfere with sexual functioning. However, severe urinary symptoms can be embarrassing and sometimes inhibit sexual activity.
Hi, Linda. Hi, Mrs. Longo. Hi, Dr. Longo. Pretty good. How are you today?
Just great.
That's good.
Been for my re-exam today.
Michael, how are you today?
Benign enlargement of the prostate gland is the condition known as benign prostatic hyperplasia, or BPH. It occurs most commonly among men over age 45. It is not cancer and does not lead to cancer. However, it is possible for a man to have prostate cancer and BPH at the same time. So medical checkups for accurate diagnoses are extremely important. Doctors can easily feel the prostate gland through rectal examinations. During this simple procedure, the doctor checks the prostate by inserting a gloved, lubricated finger into the rectum. This examination enables the doctor to determine whether the prostate is enlarged and whether there are lumps or abnormal texture to the gland.
As you know, Jenny, Michael came in with some complaints about urinary frequency. He gets up at night and
while prostate cancer is less common, it can produce symptoms similar to those of BPH. Annual rectal examinations and other tests, along with frank descriptions of changes in urinary habits, help your doctor to diagnose and treat these and other prostate problems correctly. The American Urologic Association advises that men should have annual rectal exams after age 50 as part of the screening process for prostate cancer. If there is a family history of prostate cancer, yearly exams should begin at age 40.
During the night, I'd awaken, and then I'd feel this pressure in my abdomen. And of course, it simply signaled that it's time to go to the bathroom.
I began to experience difficulty in urination. There was a frequent urge to urinate, and that there was incomplete evacuation of the bladder. And at first, I thought this was a matter of a natural onset process of aging. And then I began musing over this, and I reported it after about 5-6 months to my doctor, Dr. Dupé.
How you been? Great. All right.
In addition to having annual prostate examinations, any man who notices a change in his urinary pattern should see a doctor. The changes suggestive of BPH can include a weak or interrupted stream, a sense of the bladder not emptying completely, urine leakage, difficulty in starting urination, frequent urination, especially at night, and a sudden, almost uncontrollable urge to urinate.
My pressure's 120 over 80 like a little kid.
All right.
These symptoms are not an automatic result of getting older. In fact, problems like these may be caused by BPH, a condition for which treatment is available. Only a doctor can determine if urinary symptoms are caused by BPH, as well as check for the presence of cancer. But the doctor won't know that you have symptoms unless you talk about them. Remember, only a doctor can evaluate your symptoms and their possible causes.
Dr. Joseph, how are you today?
Just fine, thank you very much.
Good, good, good. Even though symptoms of BPH can be quite uncomfortable, many men delay seeking treatment. Some mistakenly believe that getting older naturally leads to urinary difficulties. Others delay dealing with their symptoms because they dislike medical examinations or because of fear or embarrassment. It's sometimes uncomfortable for a grown man to come in and complain of having to wet his pants. It's something that they don't enjoy talking about.
One of the embarrassing situations that patients often describe when talking about their BPH symptoms is incontinence or dribbling.
They'll often have difficulties where they have to race to the bathroom. They have to think about, is the bathroom going to be occupied in the store or in the restaurant? Because when they have to go, they really have to go. Other times they'll be embarrassed by someone who will notice that maybe their pants are stained with urine.
Some men may be embarrassed because they assume that urinary difficulties are linked to sexual problems. It is important to realize that BPH generally does not affect sexual performance. However, there are some complications that develop in some men with BPH. For instance, the condition can progress to the point where the bladder is unable to empty completely. When that occurs, urine that remains in the bladder can lead to repeated urinary tract infections. Rarely, BPH can lead to gradual bladder or kidney damage. Another complication that can occur in men with BPH is the sudden complete inability to pass urine, which is a medical emergency.
If you are having symptoms, it is important to speak frankly with your doctor because there are now a variety of treatments for symptomatic BPH. But the first step towards receiving treatment is telling your doctor if you're experiencing problems. Remember, only your doctor can evaluate your symptoms, diagnose the cause, and describe treatment options.
Now, I am not awakened anymore with bladder pressure during the night, so I'm very pleased with the results.
Your best bet is to see a doctor as soon as possible.
And I think it's a partnership. Family physician is extremely helpful. He not only talks to me, but he talks to my wife.
I think if any elder men out there my age are experiencing the same type symptoms, it's well worth the trip to the doctor. I feel like I have a hope now I didn't have 6 months ago because I didn't know what the problem was.
There's no reason why to be bashful or ashamed of coming in and speaking to a physician about them. These are symptoms we deal with every day. There's a lot of patients just like them that are having these problems, and there's treatment for them.